Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago. I'm vet student. Many clients like to say I don't overfeed my dog/cat. That's just their normal size. When their pet looks like a watermelon. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers, or explain how it got there, even after we removed it. Just kept saying I think this is all a joke, and you put it up there. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. When was their last meal? They think they can fool their PET scan, end up losing money, time and over irradiated. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions, but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc. but we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra, and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan, and she gasps herself awake. Even after that still took her a long time, before she said well maybe I did take some drugs from a friend. Since then I've trusted no one, when it comes to denying drug use. It's well known in the that a patient with something stuck up his/her/etc, but has no idea how it got there, or they fell on it. The weirdest thing I saw was a patient who came into the ED with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved a shampoo bottle up my butt, now it's stuck there. No shame. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seeds/pits. So many of them. When asked why she put them there she said back quote well I eat a lot of fruit, and wouldn't accept any responsibility for them being there. On my surgery rotation as a med student, warning this is gross as fuck, had a patient recovering from having parts of their bowel removed. As part of the recovery their intestines weren't completely connected to let them heal better, so the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 lbs. I had to round on her every day. And every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had C. diff, a nasty bacteria that anyone in the hospital can identify by smell. And she would flirt with the residents and make casual conversation while we would clean the shit off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him. Looked up to all of us following him, and when she's fingering herself covered in shit. I really wish I was making this up. So yeah she never admitted it, but obviously she was fucking tearing at all the tape covering her ostomy all night, until she broke the seal, and could get herself covered in shit again, to get attention from the doctors. This one is sad, from mild roommate. Girl had a very large lump on her breast, that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines, because they giving her a lot of pain in her last months. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later, when you aren't having a seizure. Only work records in a clinic, but we had a woman come in with a report of vagina loader. All well and good. It happens all the time in an ob/gyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in no maternity ward in their hospital, and she was in advanced labor when she arrived, and she still insists she's a virgin. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. Not a doctor, but many years ago was working as an assistant to an occupational therapist. We got a call out to help mobilize a woman who had been morbidly obese and was told to lose weight. We learned from the daughter she had gained weight, but her mother would refuse to come clean on what she was eating. All the daughter knew was that her mother may have been eating deep fried food due to the vast amounts of cooking oil she found in the pantry. When we arrived, she had gained an extra 6 kilos, but insisted she had lost weight. She did not look it. Before we began mobilizing her and check her living room for trip hazards, she also had horrendous knees. We took a look at the pantry. Olive oil, peanut oil, sesame oil, any kind of common cooking oil you can find off a supermarket shelf. She had it. A vast stockpile of oil. We asked what she was frying with the oil. She insisted that she wasn't frying anything, and that she was eating healthy, since the oils she used were healthy. We had to explain to her that oils are still fatty, and will still contribute to weight gain. After a bit of poking around the pantry, I noticed that for the amount of oil she had very little in food that could be traditionally fried. She also had little in other foodstuffs that could explain the obesity. I brought it up with the therapist and the therapist then demanded the truth. We couldn't provide complete healthcare until we knew everything. She admitted that she thought healthy oils would help her lose weight and suppress the appetite, so she had taken to drinking the bottles of oil whenever she got hungry. Needless to say, we disposed of most of the bottle of oil and set her up for a home visit with a dietitian. Not a drive, but worked in a hospital for a long time. Had a part come in that had odd on heroin. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out after a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and churlish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. I volunteer at an prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Ike insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important, because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. I'm a court tech, and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has sex with men. Well, the blood test came back positive also, surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget.